a common viral infection of the nose and throat. In contrast to the flu, a common cold can be caused by many different types of viruses. The condition is generally harmless and symptoms usually resolve within 2 weeks. Sneezing, stuffy and runny nose. You might have a cold. Colds are one of the most frequent reasons for missed school and work. Every year, adults have an average of 2 to 3 colds, and children have even more. Antibiotics do not work against viruses that cause colds and will not help you feel better. Causes: more than 200 viruses can cause a cold, but rhinoviruses are the most common type. Viruses that cause colds can spread from person to person through the air and close personal contact. Risk factors: many factors can increase your risk of catching a cold, including close contact with someone who has a cold. Season colds are more common during the fall and winter, but it is possible to get a cold any time of the year. Age: infants and young children have more colds per year than adults. Symptoms of a cold usually peak within 2 to 3 days and can include sneezing, stuffy nose, runny nose, sore throat, coughing, mucus dripping down your throat post-nasal drip, watery eyes, fever, although most people with colds do not have fever. When viruses that cause colds first infect the nose and sinuses, the nose makes clear mucus. This helps wash the viruses from the nose and sinuses. After 2 or 3 days, mucus may change to a white, yellow, or green color. This is normal and does not mean you need an antibiotic. Some symptoms, especially runny or stuffy nose and cough, can last for up to 10 to 14 days. Those symptoms should improve over time. When to seek medical care, see a doctor if you have trouble breathing or fast breathing, dehydration, fever that lasts longer than 4 days, symptoms that last more than 10 days without improvement, symptoms such as fever or cough that improve but then return or worsen, worsening of chronic medical conditions. This list is not all-inclusive. Please see a doctor for any symptom that is severe or concerning. Colds can have similar symptoms to flu. It can be difficult or even impossible to tell the difference between them based on symptoms alone. Learn more about differences between cold and flu. Common cold symptoms: anatomy of the nasal cavity, pointing out symptoms of the common cold. When you have a cold, mucus fills your nose and could cause postnasal drip, headache, and a sore throat. How long will symptoms last with a typical cold? Symptoms of a cold can last 8 to 14 days or more. When you have a cold, a sore throat could last for 8 days. A headache could last for 9 or 10 days. Congestion, runny nose, and cough could last for more than 14 days. Baby, talk to a healthcare professional right away if your child is under 3 months old with a fever of 100.4 degrees Fahrenheit, 38 degrees Celsius.
How it spreads: by airborne respiratory droplets, coughs or sneezes, by touching a contaminated surface, by saliva, kissing or shared drinks, by skin-to-skin contact, handshakes or hugs. Treatment: your doctor can determine if you have a cold by asking about symptoms and examining you. Your doctor may also need to order laboratory tests. There is no cure for a cold. It will get better on its own without antibiotics. Antibiotics won't help you get better if you have a cold. When antibiotics aren't needed, they won't help you, and their side effects could still cause harm. Side effects can range from mild reactions, like a rash, to more serious health problems. These problems can include severe allergic reactions, antibiotic resistant infections, and C. diff infection. C. diff causes diarrhea that can lead to severe colon damage and death. Over-the-counter medicine and children: carefully read and follow instructions on over-the-counter medicine product labels before giving medicines to children. Some over-the-counter medicines are not recommended for children of certain ages. Pain relievers: children younger than 6 months only. Give acetaminophen. Children 6 months or older, it is okay to give acetaminophen or ibuprofen. Never give aspirin to children because it can cause Ray's syndrome. Ray's syndrome is a very serious but rare illness that can harm the liver and brain. Cough and cold medicines. Children younger than 4 years old do not use over-the-counter cough and cold medicines in young children unless a doctor specifically tells you to. Cough and cold medicines can result in serious and sometimes life-threatening side effects in young children. Children 4 years or older. Discuss with your child's doctor if over-the-counter cough and cold medicines are safe to give to your child. Ask your doctor or pharmacist about the right dosage of over-the-counter medicines for your child's age and size. Also, tell your child's doctor and pharmacist about all prescription and over-the-counter medicines they are taking. Prevention. You can help prevent colds by doing your best to stay healthy and keep others healthy, including clean your hands. Avoid close contact with people who have colds or other upper respiratory infections. Cover your mouth and nose when coughing or sneezing. Avoid touching your eyes, nose, and mouth with unwashed hands. Don't smoke and avoid secondhand smoke. Stay at home while you are sick and keep children out of school or daycare while they are sick.